General anesthesia affects the entire body. You have no awareness or feeling. You are unconscious and will not feel pain while receiving general anesthesia. With general anesthesia, pads with wires will be attached to your body. These wires are connected to machines that help monitor your blood pressure, breathing, heart rate, and other vital body functions. A mask is placed over your nose and mouth to give you oxygen. The anesthesiologist will give you the anesthetic through an IV and closely monitor your vital body functions. After you lose consciousness, a breathing tube or other breathing device will be inserted into your mouth to help you breathe throughout the procedure. Sometimes it is safer to insert a breathing tube while you are awake if you have certain medical conditions. If you have one of these conditions, the anesthesiologist will talk with you about the best plan for your airway. While you are under anesthesia, you may receive a combination of anesthesia drugs. Some of these drugs are given through your IV, and others are given as gas through the breathing device. With general anesthesia, possible risks and problems include injury to the mouth, teeth, tongue, or vocal cords when the breathing tube is inserted, unintended awareness, which means you become aware during surgery when we want you to be fully asleep, and decline in organ function. After surgery, there is a risk of heart problems, pneumonia, sore throat, or vomiting. Although it is extremely rare, some surgery patients can be at risk for vision loss after surgery. Please keep in mind that all of these risks and problems are not common, but the risk is not zero. Regional anesthesia blocks pain to a part of your body. It produces a loss of feeling to a specific area of the body. Regional anesthesia includes peripheral nerve blocks and epidurals and spinals. With regional anesthesia, possible risks and problems include infection and bleeding at the insertion site, headaches, nerve damage, and incomplete pain control. Patients receiving a regional anesthetic are followed by the acute pain team, who will make adjustments to pain medications as needed. When the procedure is finished, you will be taken to the recovery area where we will continue to monitor you. How quickly the anesthesia wears off depends on the anesthetics and other medicines used, as well as your response to them. A nurse will check your vital signs, bandages, and monitor your pain. It is normal to have some discomfort. However, please tell your nurse if you are in pain. Your nurse will ask you to rate your pain level using a pain score from 0 to 10, 0 being no pain, and a 10 being pain as bad as it can be. Some things you may experience after anesthesia. You may have shivering and feel cold when you first emerge from anesthesia. You may feel some numbness or less feeling in a part of your body if you had a regional anesthesia or if your surgeon used local anesthesia medicine. You may experience nausea and vomiting. This can be treated and should not last long. Also, you may have trouble with muscle control and coordination. Anesthesia can often interfere with birth control. Please refer to your after-visit summary for specific instructions. In some patients, anesthesia can affect memory and decision-making for a short time. Do not drive or make important decisions for 24 hours after receiving any type of anesthesia. For outpatient procedures, you will go home the same day. Your healthcare team will discharge you when they feel you are ready. For all other procedures, you will move to a hospital room to continue your recovery. If you have any questions about anesthesia, please contact us at 713-792-6133, Monday through Friday, 8 a.m. to 5 p.m. You may also review the anesthesia consent forms and anesthesia education materials in your MyChart account. If you have questions about your specific procedure, please contact a member of your surgical or procedure team. Thank you for watching.